Let's talk about some of the other issues that have gotten a lot of attention on Capitol Hill, and the one we'd like to focus in on is the Affordable Care Act. And now, you've called for the entire program to be scrapped, and you released a statement about this earlier this month that says this: in spite of President Obama's repeated assurances, millions of Americans and thousands of Wisconsinites lost health insurance they liked and could afford, and have also lost access to doctors they trusted. For many, premiums, deductibles, and out-of-pocket maximums have skyrocketed instead of being reduced by $2,500 per family per year, as President Obama and other proponents of Obamacare had promised. Now, you say it's not working, so what do we replace it with?
Well, first of all, the Patient Protection Affordable Care Act did not live up to its name. It didn't protect patients, as millions did lose their health care, have lost access to doctors as these networks have narrowed. It's not affordable. I mean, Janice Fenneman in Spooner wrote us that prior to Obamacare, she was paying $276 per month. Now she's paying $787. We did a telephone town hall last week, and there was a gentleman on the phone call said that he was paying $400 per month. Now he's paying over $1,000 for high deductible plans. So it's not working. What we ought to do is do what works. Now, I come from the private sector. I was in plastics manufacturing. I had to compete. I would have loved to have been a monopolist, but because I had to compete, my prices were lower, my quality was higher, as was my level of customer service. So free market competition actually works. Movement toward things like high deductible plans combined with health savings accounts. So people are actually spending their own money, making wise consumer choices. I think that's really the direction we should really go with this, is, understand that the free market competitive system, giving people the freedom and the choice to make some of these healthcare decisions themselves, would be a whole lot better. Allow insurance to be sold across state lines. Let the people decide what kind of healthcare plan they want. Don't have bureaucrats in Washington, D.C. tell you what kind of coverage you want. This has not been working. This has really been a disaster for a healthcare system. It's not going to get any better.